So I'm really looking forward to doing Botox today with Dr. Nowak. He is very well recommended from my friends, and they all have had great results. I haven't had the courage to do it, but now that I'm 42, it's really bothering that I have these creases in my forehead. So they told me that the procedure was very easy. I finally got the willpower to come and do it, and I'm really looking forward for the results. Creases that are very, very marked here. It's my expression every time I express my...
Okay, we're going to go ahead and take a look at the areas. What are the areas that concern you the most?
Actually, my forehead, every expression that I make, it doesn't matter how, smile, frown, or even just talking.
Okay, go ahead and give me a frown there. Give me a good frown. Okay, good frown. All right. So you can see how you raise up, how you lift these areas, and when you relax, go ahead and relax. You can see that the lines are less. So the Botox is going to relax that muscle, so you're not going to be able to have as much movement, and that's going to improve and soften these lines. Give me a good frown again there. So see how this muscle pulls in on each side here, forming the lines here. Some people call that their 11s. So by relaxing the muscle right out in this area, that's going to allow us to reduce and relax those lines. If the lines don't resolve completely, sometimes we can use some fillers or some laser treatments to go ahead and soften those the rest of the way. Go ahead and give me a big smile, big smile. Yeah, we're going to soften about as big as my thumb. You'll still get a little bit of these lines here because that's a little bit of cheek movement, a little bit of expression, but this here is going to relax very nicely. You'll do excellent. Okay, so when we're doing your Botox treatment, we're going to put a little ice pack there, and we just want to cool the area a little bit to make you a little more comfortable. When it gets cool, feels cold, but before we give you a headache, let us know. We'll take the ice off the area. I'll ask you to frown or smile or raise up so we can see where the movement's coming from, and that's going to help us direct that Botox right where it needs to be to get you the best result. We're going to hold a little ice there, and once again, you let us know when that feels cold. After we do the treatment, we'll put some arnica on the areas to reduce the risk of a bruise, small risk of a bruise. Only about 10% of the people, so that's unlikely there. And you'll see your Botox kicking in typically within a couple days, although some people tell me as soon as the next day are ready to see the results starting to happen. We'll typically see you back in about 2 weeks to let everything relax, let the skin relax. How's that feeling? Is that feeling
good?
Cold there? Oh, good. All right, we're going to take that from the area. Go ahead and give me that good frown and hold it for a second. Frown, frown, frown. Good. Or a little bit here. There we go. Very good. Hold it for 1 second. Great. A little bit here. Good. And a little drop there. Very good. And relax there. Good. Just relax.
Can I laugh or something?
You can relax for 1 moment. We're going to put a little ice pack on this area, cool that area off. That's all there was to it. You're doing great. Give me a big smile so I can see the movement there. Big smile, big smile. There you go. Good. Hold it. Little pick here. Very good. Perfect. Pick here. All right, go ahead and raise up the eyebrows on this area. Raise up, hold it there, hold it. Good. Let's pick here. And that's going to relax those muscles. You'll still have some expression there. We're trying to leave you with a little bit of expression, but we're trying to relax it enough so you have less movement in those areas. There. Good. Drop in the middle. There you go. So that's all there is to the Botox treatment. How was that?
It was great. Nothing, there was,
Yeah, you did wonderful.
Okay.
That's all there is to it. It's a very quick treatment. So today you can go home and take it easy. We really don't want you exercising. We don't want you playing or massaging the areas. You want to let the medication set into that area. Within a couple days, you'll see it start to relax. You'll see less movement in the areas. As there's less movement, you'll see the lines start to soften. Typically, we'll see you back in about 2 weeks. If we see that you have a little bit of movement left, we'll do a little fine tuning. We'll touch that area. And there's no charge for that. That's included in our treatment. So you did great. That's all there is to it.
Thank you very much.
And we'll see you then.
I'm very happy. Thank you. It's been about a week that I got my Botox procedure, my forehead, my sides, and it's been a wonderful experience. The change was probably a couple days after, where everybody started noticing and they started telling me that I looked better. There was a lot of comments on that I looked a little bit more refreshed in my face. I have definitely noticed the difference in 3-4 days after. My forehead is completely lost. The wrinkles and the issues, the 11 that was here, very, very marked. It's completely gone. I feel happy when I put on my makeup because I don't see any indentations or creases or wrinkles. So I'm totally amazed by it, and I would definitely do this again. This expression was very visible on the lines. The lines were marked. Now I see that they're less creased and less marked. I can't do much of the movements. I could definitely smile better and look better. That's the most important part, that you won't see the wrinkles when I'm smiling. And when I'm thinking or just in some kind of seriousness motion, you can't see like I'm angry, or the expressions don't look very marked or visible.